Good morning, everyone. I'm Rosa with Two Rivers Public Health Department. Thank you all for joining us this morning. So we hope all of you are having a happy holiday so far, and we've got Christmas around the corner. So Two Rivers Public Health Department serves almost 100,000 individuals in 7 counties. That covers approximately 4,642 square miles. So these counties include Buffalo, Dawson, Phelps, Kearney, Harlan, Franklin, and Gosper. So our Two Rivers mission and our vision are as follows. Two Rivers Public Health Department engages collaborative partners, community leaders, and the public to promote health, lifestyles, and provide preventative education, assure environmental quality, and create more healthy and safe communities for all who live within our jurisdiction. The Two Rivers Public Health Department envisions a health district where all are able to safely and actively live, learn, work, play in our communities. Two Rivers Public Health Department facilitates collaborative partnerships and unique approaches that educate, empower, and engage local community partners, health providers, political decision-making, and also community leadership and the public. So overall, we want a healthier community for all. So this is our nursing team. In the middle, you will see Jackie Haley, whom is our nursing section manager. I am on the upper corner there. So my name is Rosa Pinon. I am an LPN program nurse. And below, you will see Marilyn Workin, whom is also an LPN program nurse, and Liz Wines, who is an RN community health nurse, and also Jordan Anderson, who is a BSN RN community health nurse. So here you'll see a map, and this map actually gives you information regarding FluView, weekly US map, influenza community updates. You will see here the color-coded guide in regards to the levels. And it tells you in regards to each color there, if it is very high, moderate, low, minimal, or insufficient data. So the United States COVID-19 hospital admission CD data through October 28th of 2023 is on this map. The new COVID-19 hospital admission per 100,000 population, the past week total. So green is low, yellow is medium, orange is high, and the lines is insufficient data. With winter around the corner, I kind of wanted to give you guys some winter tips. So keep your vehicles full of gas. You don't want to get stranded out there in a cold vehicle. Start your cars and get them warmed up before you go out. Make sure you check your tire pressure and get your oil changed regularly. Prepare a winter kit and make sure that you have a phone charger within reach. And also driving tips, which I always teach my children, is time and distance. So make sure that you leave with plenty of time. Don't be rushed, and also distance in regards to distance from other vehicles, so that if somebody makes a sudden stop, you don't skid on the ice or anything, get into an accident. You have plenty of time to make a decision as far as where you need to turn your vehicle so that you don't hit another vehicle and prevent an accident. So here you'll see in regards to a kit to put together, there's water and small water bottles bottled waters that you should carry to make sure you're hydrated, a spare mobile phone charger, jump lids or battery charger. Make sure you throw a snack in there. You never know, if you get stranded, you might want to, at least you have a snack in there. So this is a little winter driving safety kit that you can put together and make sure that it is in your vehicle. And if you have more than one vehicle, then it would be a good idea to have one in each one of your vehicles. Here are some top ways to stay healthy in winter. Always stay active. Don't forget to drink water. Avoid stressful situations. I know it's kind of hard right now with the holidays and all. Eat healthy foods. There is always, of course, with our good friend Google, there is so many different recipes that we can look up that are healthy foods for the holidays. Make sure you get plenty of sleep. Stay hydrated. Wash your hands regularly. Of course, number one prevention for sicknesses is, germs. So let's make sure that we wash our hands properly. Pamper your skin with this cold, dry weather. We don't want to have any cracks in our skin or anything, give bacteria a way to get into our bodies. And also we don't want to be hurting. So let's make sure that we lotion and lather up that skin so it's nice and soft and you kind of prevent infections. Make sure that you get your flu shot. And if you have not gotten your flu shot, you can always call our office. Also fill up on fiber and winterize your gear. I thought this would be fun for you all. So preventing slips and all tips. So I have had a few incidences this past year with going to see patients as far as slipping on the ice. So I learned plenty about walking like a penguin. So remember, when it gets icy and cold, do the penguin walk. Keep your knees relaxed, point your toes out. Take short steps and walk slowly. Extend your arms out for balance. Focus on your feet. Walk like a penguin. Don't use your cell phone when you're walking. Make sure that you use those handrails when you're going up the stairs, whether you're going to see a patient or going in to your job wherever you work. Be aware of changes in the walking surfaces. So obviously, if you see a patch of ice, you want to try to go around that. Free up your hands. So if you have a bag, and you have many small things in your hand, make sure that throw those all in a big bag and just carry one big bag, anything to make it easier. So report unsafe conditions. So if you are at your job and there's a lot of ice and snow out there, you might want to report that to your direct supervisor or whoever's in charge of your maintenance or anything out there. Maybe somebody will just tell you where you can get something to put out there to kind of make sure to melt that ice so you don't have an incident. And slow down. So step down, not out of your car. So whenever you open your door, make sure that you're aware of the ground beneath you. When you open the door, you might need to hold on to the door if it's slippery, and just take it easy. Don't be in a hurry. Okay. And make sure that you wear proper footwear. So here is a HON that we received. Wanted you all to know to notify clinicians and health departments about the occurrence of Mpox. So this is there is a geographic spread in the Dominican Republic of Congo. And there is a link here that you can click on, and that will give you more information regarding that. So clinicians should notify their state health department if they have a patient with Mpox-like symptoms, which may include a diffuse rash, lymphadenopathy, recent travel to the Dominican Republic of Congo, So with the holidays, a lot of people are doing some traveling, and also there's, I mean, a typical rash. You never know with rashes. It could be just allergic reaction, or it could be something else, but if it's a diffuse rash, you might want to look a little more into that. So clinicians should also submit a lesion specimens for clot-specific testing for these patients. And we do have vaccine for Jenios. And if you have any further questions regarding this, feel free to call our office. So here's another HON that we received. So the U.S. Food and Drug Administration recently issued a safety communication warning consumers and healthcare providers and healthcare facilities not to use recalled saline, 0.9% sodium chloride, and sterile water. Medical products manufactured by Nurse Assist LLC. So the expiration dates are November 1st of 2023 to September 18th of 2025. For all part numbers, with the exception of part number 1030 10330A, and you can look at that information there. Also, there is a link below there that you can click on that gives you further data. So make sure that you check all of your 0.9 sodium chloride irrigation products. And if you have any questions, also there is also a phone number here for who to call, and also an email. So Nebraska Department of Health and Human Services continues to partner with local health departments, federal agencies, correctional facilities, and the internal community to provide and control TB in Nebraska. So the 2022 Nebraska TB annual report is out, so please reach out to us if you have any questions. The program does continue to see high risk population affected. Also, there's some drug resistance. So we do direct DOT. So DOT is direct observational therapy, which is a standard of care for all active disease patients. So DOT means a healthcare worker watches the patient swallow the TB medication to ensure the treatment is administered successfully. I am your local TB nurse for our jurisdiction, so feel free to reach out to me if you have any questions. We also have Kristen Bertrand, whom is our state TB nurse, if there is something that we need her help with. So local health departments oversee the DOT and provide case management service across the state of Nebraska. Residents of Nebraska who lack insurance or are underinsured may utilize the DHHS TB program for latent TB infection medication. I know that insurances are pretty high, so if you do not have insurance, you're underinsured, feel free to let your provider know. Obviously, they'll go over that information with you, and they can reach out to us, and then we can see what we can do. So this is the Nebraska waterways surveillance for SARS-CoV-2. The weekly average of water waste SARS-CoV-2 there, sorry about that. And it has in the red there, you can see the weekly average of water waste is shown in the red bars. Levels shown here are normalized to adjust for a flow rate and population. So water waste data for the most recent week is marked as preliminary. The trends may fluctuate as the data from water waste sites is submitted for the previous weeks. And here is a link that you can go to if you want further data regarding this. So this is our December calendar of clinics for regular and childhood vaccines. So please give us a call if you have any questions. Typically the first Friday of every month, I'm giving vaccines at El Tropico in Lexington. at 4 p.m. It's typically 4 to 6. On the 7th at 9 o'clock, we'll be doing regular childhood and adult immunizations at our office. And we'll also be doing vaccines on the 11th, the 20th, and the 21st. So if you or your children or anybody in your family needs vaccines, feel free to give us a call at the number shown on 888-669-7154. I want to thank all of you for joining us today. Does anybody have any questions at this time? Okay, it looks like nobody has any questions. So we want to wish you all happy holidays and Merry Christmas from all of us at Two Rivers Public Health Department. And if there is anything we can help you with, feel free to give us a call.